Thank you so much, and thank you, Sharon. That was really, it brings absolute clarity to everything we see on the front line about what works for our patients, and you've stolen a lot of thunder, so thank you. This isn't my natural comfort zone, talking in front of people or being in the role I'm in now. What is my natural comfort zone is providing frontline clinical care. I'm definitely a woman if you're having an asthma attack or you need a pleural effusion drained or a bronchoscopy. But I'm here, and you need me here, I think, because as a frontline clinician, I think I can do two very important roles. I can give a voice to the patients I see every day who don't have a voice, very much as Sharon has tried to do. Nobody I see in hospital has chosen to access healthcare. They've ended their, in an emergency, either an acute admission or in a lung cancer clinic, a telephone call after an x-ray. They're terrified. How they access care and the support they get, they don't have the opportunity to advise us how they want that to be delivered and what help they want. So I'm very much giving the voice to the people who don't have one. But also, I think, as a frontline clinician, it's my place to comment on judicious use of resource in the NHS as it is at the minute. And I'd like to say it's unprecedented, but it seems like it's unprecedented year on year, and facing huge challenges. Celia mentioned earlier about looking at our late-stage cancer presentation, stage 4 lung cancer. I might see somebody now in a very different position to just a few years ago with stage 4 lung cancer. If they have a targetable mutation, we'll refer them off for palliative immunotherapy, but they might have years of prognosis with that novel treatment. It's an amazing forum. That costs hundreds of thousands of pounds. One patient who might survive many years. Cost me £50 to give somebody 12 weeks worth of vape kit to stop them smoking. And yet, as I stepped in the door as a respiratory consultant, I didn't have access to anything that would have actually helped me to help the person in front of me. So, medical school teaches you somebody's being admitted to hospital with an exacerbation of COPD, that you give them bronchodilators or steroids or non-invasive ventilation. You do all those things. They go home, they come back again. You see that as a consultant. What they actually needed was to stop inhaling combustible smoke. It's inflaming their airways, it's damaging their lung physiology, it's the carbon monoxide affecting their oxygen carrying capacity. And I didn't have a resource 5 years ago that suited what the patients wanted, nothing at my fingertips. We had something that suited us, a digital tick box on a discharge form to tell our stop smoking service who our smokers were, and less than 4% took that up. The provision of the service suited the stop smoking services. It had to be localised in big pharmacies, but it didn't meet the needs of the patient. So the position of the NHS and its attitudes to and access to stop smoking services before the long-term plan was a very, very different position to where we are now. As in my 5 years as a consultant, and probably the 10 years as a specialist trainee, definitely in the last 15 years, the implementation and embedding of the long-term plan on tobacco dependency support for our patients has been the most important intervention I've seen. And it is life-changing for all the patients who are in front of me every day, day in, day out, and life-saving, cost-effective, value for money. There's absolutely what we need to be doing, and it's the stuff of joy to see our tobacco teams walking the wards, offering help to people who would have had nothing before. There has perhaps been a disconnect historically between what we were doing in the NHS and what was happening in the local authority, perhaps because of the patients presenting. I was saying they hadn't chosen to be there. They're not the people who self-presented to stop smoking services, but they're arguably the people who need it the most. And so where we are at the minute has given us this phenomenal opportunity to work more collaboratively across the system with our key partners, Amanda due to follow me. It's a huge challenge bringing all these different agencies together and all the different partners, and really we're just so phenomenally lucky in the North East with the legacy of a regional tobacco control programme, with the clarity of mindset of our directors of public health, Eugene Milne. We had previously Amanda Healy and Alice Wiseman now as co-chairs of the task force. That cross-system vision, and then built on that most recently by our ICS, our ICB, having really clear commitment, financial investment, having it as key parts of their strategy to address this has put us in such a favourable position in the North East. We're incredibly lucky. It's acted as a platform to host the task force and really all come up with this shared vision, a slide we've shared in many forums, including internationally. Elsa and I have taken it to Geneva, but that anyone, anywhere in our region who smokes is offered high quality, consistent support, no matter where in the system they touch, you know, whether that's primary care, secondary care, social care, housing, and that quality of intervention is high, and all working towards that shared vision. I think because of the advantage that we had, our ICB was so supportive that we should go further, farther, faster, and implement at scale for the long-term plan. And we had the capacity to have Rachel McAvenna, our strategic manager, really overseeing this and getting it up and running so effectively. We're ahead of the game nationally, and it's important to keep reminding ourselves of that. And that has opened up many other doors. We've been quick off the mark for the SMI pilot projects, and we're piloting in a general practice population, a much bigger footprint, much bigger cohort than elsewhere in the country. And our staff tobacco dependency offer led by Caitlin has been nation leading. We've had nearly 2,000 frontline NHS staff sign up for stop smoking support with really good outcomes, and we're heralded, you know, on national platforms for that. So we're incredibly lucky, and by doing stuff at scale and with such clarity of vision, it brings with it gains across access to communication packages. We've said how important that is, about training across systems. You know, our local authority, stop smoking advisors, our hospital advisors all access the same training, all you know, with the same view, really understanding what each other are doing. And Rachel's worked hard to build the peer networks to engender that across the region. And clarity and ability to advocate on a national scale. Amanda often heading down to all-party parliamentary groups and to work with Ash closely to really have our voice high up there. So we're in a very fortunate position. And the return on investment speaks for itself. And I know Neil mentioned it this morning, that it's a cheap intervention with a proven evidence base. And I see that in terms of patient outcomes, but the trusts and the NHS will see that in terms of reduced readmissions, more bed days, and saving in overall costs. And more bed days can't come soon enough. We've just opened up a ward in what was otherwise an office block last week in our hospital. So, you know, we need this, absolutely. There's a huge scope for further ongoing work as we're learning from the work we're doing. We're reaching people who've never accessed services before, and we needed to be guided by them and what they say they want and need, much as Sharon's alluded to the SMI population, the maternity population, learning from the evidence base and making sure we're offering them the interventions when they want, how they want it, with the products they want, on a timescale they want, and that it's really barrier-free access, and that we can learn from all of the different work streams that we're progressing with. So I think our position in where we're up to with our long-term plan implementation and being ahead of the game has really put us in a fortunate position. Didn't always feel fortunate at the time, but of really being able to stress test current services and pathways and work out where our weaknesses were and how we embed improvements in them, and come together as DPHs, NHS leaders, secondary care, primary care, and work out how we continue to evolve and deliver at scale and place, and the clarity across all those networks, such as the ADPH vision statement on vaping is really helpful to us as frontline clinicians. That collaborative system-wide working is absolutely invaluable, and we're very fortunate to have that. But there's still so much to do. We need to mainstream this agenda in frontline clinical practice still. Our patients need to know that we are seeing tobacco dependency as a clinical condition that we can treat and that we've got products for. All of our frontline staff, from the very healthcare's checking them in, the porters moving them around the hospitals, the receptionists in primary care, all need to see it as a clinical condition that we can recognise and we can treat, and that there's help for. And embed that in our culture. And it's not a short-term game. You know, we're 2-3 years into this, and there's a huge culture change needed across organisations still. So a work in progress with a long-term vision, probably over a decade. We've learnt so much from our pilot projects, and we need to build on that staff offer, SMI offer, and the work of our colleagues up and down the country, like Sharon's alluded to. And I think Amanda will come to our shared learning between what we've learnt from the people we've reached with these services and where we've identified barriers, and vice versa, their experience in this sector clearly informing NHS practice. But as I mentioned with that whole system vision, we all need to have a clarity of message that sees somebody who is dependent on tobacco needs to know that wherever you are, wherever you touch the services, that you get a high standard offer of support, products and advice, and that is there consistently for these populations who really need and deserve it the most. Thank you.